Please join me in welcoming Mary Brainerd, our President and CEO.
Well, good morning. Pretty provocative stuff, don't you think? I really liked the concept of health spring. Actually, any spring right now sounds really good, but health spring sounded particularly terrific. And I think the presentation that Dr. Topol gave us this morning captures for me the wonderful opportunity ahead that we have to change healthcare, to improve health, and to shape the future. He alluded to the point that I think it's by 2025, there's an estimated shortage of nurses that numbers 500,000 in our country because of the aging population. And I think it will only be through figuring out how to change care delivery in dramatic ways using technology that we will avoid some of the shortages that challenge us today when we look at a future that's just a continuation of what we're doing today. So some of the other things that Dr. Topol mentioned that are front and center for us: empowered consumers, people who have more choices, more options, more information. I think the estimate is that about 75% of healthcare is information exchange. So clearly an opportunity to look at new ways of making that information available to people and the promise of technology to change the way that we work. I think HealthPartners is in a really unique position. We're in that unique position because we are both healthcare delivery and healthcare financing. That gives us an insight into what the challenges are, what the opportunities are, actually what works and what doesn't, and how to move from concept to operations. And bringing the advantage of that deeper insight to the work that we do to make health better and more affordable is really what we're all about. Now, we're fortunate in our state. In general, we come from a position of strength. We've got a lot of assets. Now, I'm using largely some United Health Group information. Take a look at each year how the states rank. Minnesota, third healthiest state, first healthiest for seniors, fifth highest in the percentage of our population that has health care coverage. Fittest metro area, which comes from the American College of Sports Medicine. So good outcomes, people living longer, healthier lives in our state. I don't think that's by accident. That's a reflection of our delivery systems for sure, but it's also a reflection of the healthy and thriving communities that we're really fortunate enough to live in. So how about affordability? Well, not perfect. This is a chart from Dartmouth Atlas that looks at healthcare costs per capita for people who are enrolled in Medicare. And Minnesota is in the top 5 in terms of most affordable healthcare for the federal government. I have to say, I don't think we look quite that good. If you think about people under 65, we're probably average, a little better than average. And so my conclusion is healthy state, healthy people. There isn't anything that I've ever seen published that wouldn't lead you to believe that in terms of today's measures, we aren't top quality in Minnesota. There probably isn't a place in the world that you could go if you have diabetes and receive better care and have better outcomes than in our state. Pretty affordable, could do better. And so we start with some assets. The theme for today is Vision 2020. And we've spent a lot of time in the past year at HealthPartners looking at who we are, how we can face the future, and what we want to achieve. And so we have a new statement of our vision. It's pretty short, and I think captures pretty well what we want to accomplish. Health as it could be. Affordability as it must be, through relationships built on trust. And to the earlier points, not through relationships built in hospitals, not through relationships built in doctors' offices. Those I see as being extremely important for the future for at least the next 20 years, but through relationships that we connect with people in ways that they want, how they want, when they want, and build those trusted ties. So I want to talk a little bit about each part of that vision, and I'll start with health as it could be. And what do we mean by that? Well, this chart sums up a little bit different worldview. To improve health, we know we can't keep looking to the same places. We can't only look to physician offices. We can't only look at healthcare interventions. In fact, it's sort of a bummer because many of us equate health with health care. But actually, this is from work at the University of Wisconsin, only about 20% of health is reflected by health care interventions. The other roughly 80% is a reflection of the socioeconomic factors in our communities. Do people have good jobs? Are kids finishing school? Are people living in homes that they own? All of those things make a difference in whether or not we have a thriving community. And of course, that connects to healthy behaviors, the 30% on that chart. Do we have people, as many of you know, it's our mantra, do people exercise for 30 minutes 5 days a week? Are we eating 5 or more fruits and vegetables? No smoking, responsible alcohol use, and safe sex, big predictors of health and well-being in the community. And then finally, the environmental factors that affect us. So we know we need both. We need both outstanding, top quality health care delivery. And in our state, and particularly in HealthPartners, we've never been afraid to look at performance, to be clear about what's working and what's not, to make that information available directly to consumers. We have a 17-year history of publishing quality results online, making that available directly to consumers. Similarly, we're not afraid to empower consumers in ways that are valuable. We've released more than 10 million lab test results online to patients as of now. And I think that might even be an old number. So this question about how can we make sure that we look beyond the healthcare system to the factors in our communities that can make a difference is one that's really important to us. It's been critical to our actions, and this is a Health Affairs article that was published a little bit earlier this year that talks about the community model that we've used to focus on non-clinical factors in addition to clinical factors that relate to better health outcomes, and by that I mean healthier individuals and healthier families. I want to mention one of those initiatives particularly and spend just a second or so on that. Can you believe that's Minnesota? It's like I just want to leave that picture up there because it's hard to imagine that we're going to see that again in hopefully just a few weeks, not a few months. One of these programs is Yum Power, and the studies that exist show that fruit and vegetable uptake has a really big impact on childhood obesity. And we know that of all of the things that we could do that would change chronic illness incidence, having healthy lives, physical activity, and avoiding obesity in our community would be a really important factor. So of all the things we can do, we know that the hardest one for people is to eat healthy, to eat those 5+ fruits and vegetables. And in fact, I know Tom Kotke's in the audience. He's a cardiologist that we work with very closely. He said one of his patients told him, I can't eat 5 vegetables because there are only 3 meals in a day. So big challenge. We've involved, and this looks fun, and actually it is. It's designed to be fun and interactive and for kids to enjoy it. But so far, we've worked with more than 25,000 kids in the Minneapolis, St. Paul, Anoka school systems, and directly in 60 schools. The program involves tracking, some competition, a lot of fun, and we've seen a 10% increase in students reaching 5 fruits and vegetables today. We're taking it the next step to do much more rigorous research on whether those results and improvements are sustained. The thing that I've liked the best is some of those schools have told us they've had to increase the amount of fruit and vegetables they have for school lunches once we start the program. This is also a big deal because when you think about what are the things that have impacted smoking rates, Having kids be an advocate for parents not smoking has been a very powerful factor. So if kids can advocate for healthy eating in homes, we know it can affect moms and dads as well. This is an initiative that really focuses on better health, prevention, partnership, and shaping the future. We also know that improved access, and let me say by improved access, we like improved access to our physical locations, but we know that many people prefer the convenience of access to care and services that they want in new ways. And so breaking down the ways that we can provide that access was really the beginning of Virtuell. We've really challenged ourselves to say, is there a way that we can out-minute clinic by making those convenient access to convenient services that people want. And as Eric noted, saving $88 per episode. And interestingly enough, too, we've measured time savings, an average of about 2.5 hours of time savings for individuals versus traditional clinics. So I told you about the 10 million lab test results online and a big increase that we're seeing in use of e-visits on the part of patients and members who want that access. So call, click, come in. It's like financial services. Some people will want the traditional relationship of walking in and having a human interaction face to face and will not feel confident in care that they receive other ways. Others will be completely happy with a connection on the phone or online, and many will want to use combinations. And that's our challenge, is to make those combinations work for the people that we serve. Oh, and by the way, a really important place to make services available, at work, where grown-ups spend most of their non-sleeping time. How important to provide support for healthy living, chronic illness management at worksite locations, and we're seeing many more employers consider how they can help with productivity in using on-site locations. In this example, we know that one particular employer has had more than 9,000 patient visits, saving 14,000 hours of avoided time outside the office and $243,000 in employee savings. So we know that one of the challenges in creating this world of the future, where we use technology, where we meet people where they are, where we're engaged in creating a healthy community, our ability to do all that right now stands in opposition to the incentives that are created in how we pay for health care. So we're moving away as quickly as we can from volume-based payment systems to payment approaches that focus on results. And those results are better health at lower cost. We want to avoid fragmentation and focus on total costs of care, per capita measures. We want to focus on not only treating illness, but preventing illness, and not have that be secondary to a billing system that exists today. And move away from traditional care only to being able to accommodate in our payment systems these emerging care alternatives, and particularly technology-based options. Now at HealthPartners, we've been working on changing our payment approaches for a long time, and we have about 85% of our members now cared for in delivery systems where we've changed the incentives and moved away from fee-for-service. And by the way, if you think it's hard to understand some of the specific codes and bills today, wait till you start looking at the ICD-10 results, where there's even a diagnosis code or a billing code for knitting. I'm trying to figure out if they think that's a problem or if it's injury associated. So that actually is a great transition to affordability as it must be. And as healthcare starts consuming nearly 20% of the GDP in our country, we know that the costs that are associated with healthcare are simply consuming too much of the dollars that need to go to other things, that need to support school systems, that need to be directed towards education. And so we think affordability, whether it's out of your pocketbook, your paycheck, or your tax bill, has got to be addressed. People wonder, what about the Affordable Care Act? Hasn't that addressed that concern, or won't it when it's fully effective? And our perspective is the Affordable Care Act, and I believe this sincerely, will ultimately end up making sure that coverage is available to more Americans. More people will have health care coverage because of the Affordable Care Act. But it doesn't do a darn thing for affordability. So that challenge is still out there. It's one that we see as a top priority. It's what we hear from you, that your key concern, especially in a state like Minnesota, is actually quality is assumed, but costs are unaffordable. So we need to move ahead ourselves to shape the future to be more affordable. It began, as I noted, with figuring out how we can prevent the health problems in the first place through initiatives like Young Power, how we can create more affordable, easy-to-access options like Virtuel, changing the payment system so that we can support the results we're looking for, which is more affordable health care, sharing information on quality and health in a transparent way directly with consumers, and intervening to change the health care itself. A couple of quick examples. Spine care. Got a lot of publicity recently about whether or not spine surgeries, particularly lumbar fusions, are effective, and it looks like about half the time people don't get the results they're actually looking for in having the surgery. And actually, each of those surgeries costs about $25,000, and that doesn't count what happens afterwards if the surgery is not as successful as hoped for the individual patient. So we designed a new approach. It's actually similar to how you might receive cardiac care. If you have a heart problem, you generally see a cardiologist first, a cardiac surgeon second. You don't go to the cardiac surgeon first. However, for spine care, people are generally approaching either the orthopedic surgeon or the neurosurgeon directly, and instead, we've created a process through which people actually see a medical spine specialist first. A little controversial. We took a little heat on this one, but the results, I think, are really important. We know that lumbar fusions in our membership dropped by nearly 30%. People who go to see a medical spine specialist and still want surgery, nobody stands in the way, but simply better understanding options, alternatives, and what might be a good reflection of individual values has turned out to have a big impact on the decisions that individuals make. So what are those results? Reductions in admissions, reductions in use of high-tech imaging, reduced prescribing of narcotics, another really important and top quality focus, and a reduction in surgical referrals. We think that's a success. Another, again, talking about narcotics, we know that some of the fastest growing areas of abuse leading to heroin use, recent article in the Minneapolis paper talking about this, begins with misuse of narcotics and opioid prescriptions like Vicodin and oxycodone. That cost is about $78 billion annually in abuse of prescription medications. Big impact on the criminal justice system, big impact on our teenagers who look to be the people who are most likely to get into misuse of prescription narcotics. Again, we've designed a different way to approach this challenge, and that is with our patients who are using narcotics to develop a care plan, which doctors and patients agree on a process to use the lowest effective dose and to discontinue use. A drug screen so that individual patients actually work with us to make sure they're on a plan to avoid continued use of narcotics that can represent more harm and risk than good in the long haul. And the third point, a signed agreement. It's actually a mutual commitment on the part of caregivers and patients to use this medication appropriately. The result, nearly 30% of our medical group patients who are using opioids have a documented care plan, and that a year ago was at 10%. Thanks to this, we're seeing a reduction in the number of our members with high use of narcotic prescriptions. That number's gone from 800 by the end of 2012 to less than 500 at the end of 2013. And we see continued opportunity in this area. So, what about the next steps? Well, you know, we've talked about some data, talked about some programs, talked about population health, but for me it really comes down to individuals. And the story that a patient and member told me this past year that had the greatest impact on me and as an individual was the story of a guy named Dan. He came up to me at a meeting and said, I hear you work for HealthPartners. And I said, yes, I do. And he said, well, I've got a story to tell you, and it's my own story. And he's a freelance photographer and had, last winter about this time, been the photographer not only as his job, but he was also the parent photographer for his son's high school ski team. They were up at Wild Mountain, and he said he was in kind of the emerging twilight light, wasn't paying attention to where he was, and he inadvertently backed over an alpine slide. So he went down the slide, serious, very serious injuries, broken back, multiple other injuries, ended up at Regents Hospital as a trauma patient, was helicoptered in. It was not clear whether he would ever walk again. And I was seeing him probably in August. And he walked fine. He looked just fine. He said he felt like the care and treatment that he received was exceptional, that people had really cared about him, and he had felt supported every step of the way. And I thought, well, that's a great story. I love hearing those stories. He said, but I want to tell you that the story doesn't end there. The story continues because I used my health plan coverage every step of the way to make sure I knew what my most affordable options were, to make sure that I was getting the best advantage of the benefits that I have. And he said it took us till just a couple of weeks ago for me and my wife to sit down and look at our health care bills. And he said, I have to tell you, it was a couple of $100,000. So it's like, gasp, that's a lot of money. He said, what I'm really grateful for, and he said, I know that this has less to do with HealthPartners and my coverage levels have more to do with my employer, which is 3M. But he said, out of that couple of $100,000, like $2,000 is what my wife and I paid. He said, I am so grateful for my good health, but I also want you to know that my family is so grateful for avoiding the financial hardship we might have paid. He said, my son, the one I was there to take the pictures of, he's going to college this year. And the difference between a bill of a couple of $1,000s and $30,000 or $40,000 or $50,000 is the difference between my son going to college or not. So it reminded me of the importance of both financing and delivery, and more than all that, the impact that we have on lives and families and people that we care about in the work that we do, and the importance of continuing to keep that central in the focus of all of the actions that we take. So we're looking at how can we make those individual relationships better? How can we get a glimpse of the lives of our patients and our members through their eyes? Dan gave me a glimpse through his eyes, and I carry that with me. It frankly is extremely motivating because I remember what to care about. And relationships built on trust, that's when people won't feel they need to be connected through a visit in an exam room only. They'll feel connected to that trusted health professional through their interactions online, through technology, through all the means that we have to connect with people. So one of the ways that we're looking at making relationships better by using data is medication use. Did you know that 50% of the time medications aren't used correctly? That 20 to 30% of the medications that are prescribed are never picked up. Some of the most advanced healthcare will be delivered through genetically designed medications, and yet we're still handling those interactions through essentially, here's your prescription, good luck with that. We know there are smarter and better ways to support our patients. We're using many apps actually right now to figure out those that work most effectively for patients and members with different conditions to support appropriate medication use. And we know that's $177 billion in wasted healthcare expense when medications aren't used correctly, and it accounts for 150,000 deaths in our country every year when medications are misused. So we're tapping into our relationships with patients and members to change that dynamic, doing some simple things like sync my meds. It's a free service to help sync up prescriptions so that you're not confused about which medication do you need to actually refill when and use when. RX checkup, free pharmacy consulting to make sure that patients, and we have many elderly patients who are taking 10 or 15 or more medications at a time. And then for people who like that personal interaction, pharmacy navigators to support appropriate medication use. Finally, we are continuing to focus on how we can give information, make it available, accessible, and frankly now how we can transform into using mobile even more extensively than in the past. Not only thinking about online access to websites, but what information can we continue to push and make available to patients and members. And want to make that information a little bit more available to you by sharing a little bit of a video.
Say you get a call in the middle of a busy day. It's your son's school. He's in the nurse's office and says his ears hurt again. He's already had quite a few ear infections this year, and you want to get him checked out as soon as possible. You use your HealthPartners mobile app to make sure the clinic nearby is open. When you see it is, you pick him up at school and head right to the clinic. After getting checked in with your mobile member ID card, you're in with the doctor. It's another ear infection, his 4th this year. With prescription in hand, you head home to get your little guy better, but are worried about his frequent ear infections. Over the next couple of weeks, you see his doctor and a specialist and find out he needs ear tubes. You're nervous about the surgery, but know you have great options in your plan network. To compare doctors, you log on to your HealthPartners account and use the Easy Care search. You can see estimates of what your actual costs will be based on your health insurance coverage and deductible. It even gives you information on quality ratings and satisfaction, giving you peace of mind knowing there won't be any surprises. As you're browsing through the list of providers, you choose 3 to compare. You've heard great things about your first option and are happy to see he's also the most affordable. Feeling confident in your decision, you make an appointment. Your son has the surgery and it goes really well. When you get his medical bills, you appreciate that you get an overview of his treatment in the activity section of your HealthPartners account. You can compare your bills to his claims and explanations of benefits, and even get a cost breakdown. Plus, you get tips for how to save money at future visits. And as your family needs care throughout the rest of the year, you can quickly see where you're at with your deductible and other plan balances on your computer, smartphone app, or by texting. Hopefully, you won't be back for another ear infection anytime soon, but you can rest easy knowing you have HealthPartners. Your family's health is supported every step of the way.
Another example, final one. We know that one of the areas where relationships have been most challenging has been the relationship that people who experience a mental illness have with the rest of us in the community, and with the reluctance to receive the support and care that's often needed when individuals are experiencing severe mental illness. In fact, the delay in seeking care from the time symptoms are experienced averages 8 to 10 years. And on top of that, we know that 1 in 4 people will experience a mental illness at a diagnosable level in the course of a year. So one of the things that we've spent time doing is, over the past decade, working with many in the East Metro area, and by that I mean with the Mayor of St. Paul. We've worked with city, county, police, the court system, community service agencies. The state has been involved, and the total number of entities involved in looking at how we can deliver better support for people with mental illness totals 25 organizations. We've had some nice results, haven't had a huge amount of promotion about those, but one of the results has been the creation of a crisis mental illness center in St. Paul, operated by Ramsey County. Some of you probably know about that. It's an extremely effective program. We also have a program to make sure that anyone with a mental illness, regardless of their health care coverage, will have access to the medications they need 24/7. Again, very effective, and about a third of the time, I think it's actually more like 40% of the time, we're able to provide health care coverage for those individuals who don't have it, who we identify through this program. But one thing has stood in the way that we know has needed to be addressed, and that is stigma. That really stands in the way of people getting support and care. And so our focus in the past year has been around an ambitious public education program called Make It Okay. Our partners in this effort are the 25 organizations that have been part of the East Metro Mental Health Roundtable. We've had a lot of support and help from TPT, from the Bremer Foundation. In Red Wing, the Red Wing Foundation has stepped up to say they see this work as extremely important. And NAMI, the National Alliance on Mental Illness, has been our really dedicated partner in bringing this work forward. So the Make It Okay campaign really focuses on this message, which is if we can talk more about mental illness, if we understand it better, we'll make it okay for people to get care and treatment and support for an illness that stands in the way of them having a healthy and thriving future. So that's our vision, health as it could be. And we know there's still so much potential. Affordability as it must be, because we won't have people have access to health care if we can't make it affordable. And through relationships built on trust. That's what we look for. That's what we're hoping to achieve. And as a sign of our commitment, we've introduced a new logo. And that was just about a month ago. Now, we're really thrifty folks. And plus it's wintertime, so nobody wants to put up new signs right now. So you can expect to see that new logo roll out over time. It'll take a little while. And so we don't want to waste money or add cost if we can avoid it. But you will see this new sign. And right now, as we've talked a lot about within our organization, this probably doesn't mean anything to you. I hope you like it. I hope you think it looks cool. The people that helped us design it actually designed a lot of neat things like the National Geographic logo and the NBC Peacock. So I think we got good designers, but it's empty. It means nothing, and it will be shaped by our interactions with you, by every touch that you have with us. Every time you connect with a HealthPartners person, it will help you decide what that logo means and what it stands for. What we want it to stand for is health as it could be, affordability as it must be, through relationships built on trust. So thank you very much. Appreciate having the time with you. And I have to bring my 2 book recommendations from Dr. Topol back to the table. Thank you.